Hello, Amplify Nursing listeners. This season, we're trying something new, partnering with our Penn Nursing magazine to bring you additional content inspired by the stories they highlight in the spring edition of the magazine. We hope you enjoy the crossover of conversations with guests interviewed for both the magazine and the podcast, as well as additional content and context with new Amplify Nursing guests.
Hello, everyone. I'm Angela Rosa DiDonato.
And I'm Marian Leary.
And you're listening to Amplify Nursing, a Penn Nursing podcast supported by the Panola Fund for Innovation in Nursing.
Amplify Nursing features nurses who are leading the way in science, policy, and innovation.
Our guests defy stereotypes, define practice, and disrupt convention.
We highlight the breadth and depth of nursing influence on society by amplifying nurses who are pushing boundaries and breaking down barriers to build a new paradigm.
Making the connection more full-throatedly that history is a wonderful way to understand policy and practice, and not just kind of a novel exercise or kind of a hobby. History is hobby. It really should be, if you think about what we do as clinicians, the beginning of any fruitful exercise begins. If we go to a clinic, the first thing we do is do a H&P. We do the history before the physical. So history, in many ways, can ground us, and it also can enable us, I think, in many ways.
Today on the Amplify Nursing podcast, we talk with Dr. Margo Brooks Carthon, professor of nursing at the University of Pennsylvania School of Nursing. Dr. Brooks Carthon is the new director of the Barbara Bates Center for the Study of the History of Nursing. With a long-standing commitment to health equity and a research background rooted in historical methods, Dr. Brooks Carthon brings a bold, innovative vision to the center. In this episode, she talks with us about the importance of history in shaping contemporary health policy and practice, advocating for its integration into nursing education and innovation. Her goals include expanding digital access to the center's archives, amplifying underrepresented voices in nursing history, and positioning the Bates Center as a collaborative hub for both historical scholarship and forward-thinking transformation in healthcare. Under her leadership, the Bates Center aims to not only preserve the past, but actively shape the future of nursing and population health through research, education, and policy.
All right, Margo, thank you so much for talking to us today.
You're welcome. Thanks for having me.
Yeah, I'm really excited to hear about your new role as the director of the Bates Center.
Yeah, I mean, in some ways, this new role is a bit of coming home and coming full circle. And so I started my PhD here at Penn in 2004, if you can believe it. So been here for 20 years, a little over. And my dissertation focused on tuberculosis disparities between 1900 and 1935. So it was a historical dissertation. And I've long been interested in health disparities as a clinician. Coming to Penn, really aimed to understand some of the core foundational reasons that we see persistent disparities among racial and ethnic minorities today. And history gave me an opportunity to do that. And so I'll give a little historical plug. When I came to Penn in 2004, it was just a few years after a report had been published by the then named Institute of Medicine, now the National Academies of Medicine. And in that report called Unequal Treatment, it really laid out the ways in which health disparities were related, at least in part, to differences in healthcare delivery, and the fact that many racial and ethnic minorities were receiving healthcare in lower quality healthcare settings. And so in taking on a historical dissertation, I really wanted to understand, okay, well, outside of the healthcare delivery, outside of healthcare settings, what were some of those other factors? And so history allowed me this opportunity to do like this unwinding and this kind of digging into the deep, complex, and intersectional and the real complicated nature of disparities. Um, but what I found in my dissertation was very similar to that report, is that many of the reasons that people experience health disparities, yes, was because of poverty and segregation, yes, because of racism and discrimination, but also because they were either barred from accessing healthcare altogether because of segregation, or where they received care was of lower quality, or they wouldn't access care because of a lack of trust. And so history for me has always been this way of connecting contemporary to context, because none of what we see today occurs in a vacuum. It all is temporal. It all has this kind of root causes. And so flash forward from that dissertation and working more in health services and policy, this opportunity now to return to the Bates Center as the director was really offered an opportunity to, one, continue to steward and preserve the very rich history of nursing, right? It's a center for the study of the history of nursing, but understand nursing in its fullest version of itself. And so many times if I ask the common person off the street, name me one nurse, they'll always say Florence Nightingale. So how can we expand the public imagination of what nursing can be? Well, we can do that by showing nursing in its fullest view of itself, and by documenting, preserving, and stewarding the broad breadth and range of the diverse voices and contributions of nurses from many, many backgrounds, men in nursing, Indigenous nurses, Black and Hispanic, of course, but we just really need to do a better job of expanding that. And the Bates Center started that work, and I look forward to continuing it. Making the connection more full-throatedly that history is a wonderful way to understand policy and practice, and not just kind of a novel exercise or kind of a hobby. History is hobby. It really is, should be, if you think about what we do as clinicians, the beginning of any fruitful exercise begins. If we go to a clinic, the first thing we do is do a H&P. We do the history before the physical. So history in many ways can ground us, and it also can enable us, I think, in many ways in times when we feel unsure or unmoored. I think that if we look back historically, we will find that there were times where we felt unsure and unmoored, and that there are examples and exemplars that will provide tools and strategies that were used in the past that might help us even today.
Yeah, and right now is a great time to look at those exemplars and how to get through really challenging situations. I have been a big fan of the Bates Center, ever since I came to Penn, because I do quite a bit of policy. And for me, it always feels like when I'm in the room and we're talking about different policy and I know the history behind the policy, it almost feels like cheating a lot of the times, because so many people are not familiar with how we ended up where we are. And I think that I should pose the question, how important do you think it is for nurses to be stewards of that history?
I think it's really important. So nurses have had a long role in advocating for policy, and I'll use the nurse practitioner movement as a really good example, one in which the practice of NP care delivery changes from state to state, but and where there's been a lot of historic pushback against full practice authority. But through nursing advocacy, strategic planning, thoughtful lobbying, raising the voices and the concerns of people, patients, and communities and settings that don't have access to healthcare, all of these together as a collective have shifted policy, and shifted policy so that 28 states now have full practice authority. And we couldn't even say that a few years ago. But the pandemic showed many states that were considering or on the fence that we need to widen access to healthcare, and we need to allow nurse practitioners in particular to practice to the full extent of their education, training, and background. But history shows us that there were strategies used to get to full practice authority. It doesn't happen overnight. There is a lot of planning, forethought, evidence, and skill. And so understanding how that happens will allow us, I think, to charter other advances that we need in the profession, charter unsubtleties that we might be experiencing now, but we've done it, right? In its infancy, the MP practice movement was, we couldn't imagine where it is today, but policy and advocacy has led us to where we are, and it's going to lead us, I hope in my lifetime, to full practice authority in all states.
Yeah, I think that that's a fantastic example. And how do you see the Bates Center as playing a part in that?
I guess in two ways. I mean, the Bates Center has been around for 40 years, and what it's been able to establish through its collection, through the scholars who've previously worked in the Bates Center who've now retired, but really for their careers as nurse historians, help to build a collection of knowledge that is really the envy of the world. Like it really, there's nowhere like it that has the amount of collective preserved artifacts around kind of nurses over time, particularly over the last 100 to 140 years. So it's quite unique that way. And now I think the question is, how do we make that accessible, right, to all, so that you don't have to come to Philadelphia to access that material? Uh, and one of the ways to do that is through technology and digitization. And so that's a big, bold undertaking, but one I think that we should be up for. So one of the things is uh, kind of informational equity, making sure that we can allow this rich history to be shared globally. And so so that's one thing that we should be doing in the future. The next thing is, and I think I alluded to this earlier, is really expanding the histories of those groups that have been largely rendered invisible. And so that needs to be done with forethought. Some of it is, stewarding into perpetuity also takes a certain amount of fiscal savvy because holdings and collecting and processing and inventory, all of that takes person time. And so we need to think about how do we think about amassing the resources to digitize and to do and to collect and to hold, because we have to think about space. So that's kind of operational. From a visionary standpoint, I think in addition to digitizing and diverse perspectives is also thinking about how do we integrate history into the curriculum, right? Into the fabric of nursing schools. So if you're at Penn, you have access to a history of nursing course, but how can we create materials that other faculty across the nation and even internationally would be able to access, so that they would be able to integrate nursing's rich history into their introduction to their foundational understanding of who we are as nurses. Because again, I believe if you know who you are, you can dream about where you can be. Like nurses in 1890 never could have imagined us not just being trained in universities, but being nurse scientists and nurse practitioners. Nurses were trained in hospitals, like in the apprentice model. So seeing where we started to where we are now, when you frame your orientation of a profession in that way, it allows you to just dream. And that's the other thing. How can history be, or the History Center be, a futurist space where we can dream and ideate about where we want to go, and using the History Center as a platform for transformation and for innovation? So that kind of takes us out of just preservation and learning about our past to really it being the History Center being a springboard for generating policy and practice innovations, because we know we can do it. it's not a I think we can, it's I know we can, because look at all of these amazing nurses behind us and before us who have charted the way. So I really love to see the History Center thought of in that way, and also engaged by people who are not, necessarily doing history as method or doing history as a researcher. Really thinking about how we could have a space where those who are trained in historical methods are working side by side with those who are working in other methods, but thinking about kind of this new meshing of methodology to come up with this, what I believe to be a deeply anchored scholarship, right? And so you can imagine someone whose interest might be in substance use disorder contemporarily around the opioid epidemic, but understanding that contextually within a larger framing of how substance use disorder has been thought of and managed over time. So we might use the crack cocaine epidemic as a way to understand the way policies and priorities are generated depending on who is front and center in terms of that public health challenge, right? The COVID epidemic has shifted the way so many of us practice and think about healthcare. So that's contemporary history, but a very potent one. And so we might think about, how do we understand public health emergency priorities and preparations going forward, with the understanding of how we contended with the COVID pandemic most recently. I think about housing, people who are interested in housing, people who are interested in violence reduction. Like, so many of these contemporary concerns have a historical antecedent. And so when we think about housing, how do we think about redlining? When we think about, of course, in the areas that I study, community health centers and hospital care delivery, all of these things have evolved over time, and are artifacts of the ways in which healthcare has evolved. And so, thinking about a history research lab where we put people together to think about their research in context with this larger contextual narrative, I think would enliven and deepen and contextualize a lot of the research. Like you said, you feel like you're cheating because you have this background knowledge. Well, imagine what this research that we are producing now would look like if we had this deep frame to work from. It really could change the way we think about solutions, for example, or policy setting, because we have a deep knowledge of kind of root and systemic changes, and we have that sense over time.
I think that all of those things have so much potential
Mhm.
to really make so much of what the research of what is coming out now be so much richer.
Mhm.
And I'm really interested. You talked a little bit about sort of marrying together the idea of historical context and innovation. And we have such a huge innovation lab here at Penn. How do you see those two things working together?
I mean, partly, I think it's one of the unique things of having been here over this last 10 years, where we really deepened our footprint in innovation, and I've been a beneficiary of that. That has helped me see or vision the way that innovation and history can play together. And I don't know that most people would think about it in that way. But I am deeply interested in thinking about, how do we create space? So, in so much as that debate center represents this place where we collect, preserve, and archive, can it also be a place where we ideate, dream, and create, history being an anchor for that? And also, as we develop, evaluate, and think of our results, what does that look like when we intersect or integrate that history? And so, I do a lot of mixed methods. And so what does that integration look like? I'd like us to just have some opportunities for thought exercises when we think about the History Center as a futurist space, and where we allow ourselves to expand some of the conventions that we often think about when we think about history. And I think in doing it, it will help people, it will bring something alive in them. And it will also sharpen our innovation, right? And so when we think about innovation, we think about contextual inquiry, we think about all the ideating and getting multiple perspectives. It's also within the context of kind of the history of whatever the problem is. Like these problems don't just, you know, arrive. They arrive within specific historical contexts. And so it also means when thinking about our innovation frameworks, adding history as a lens almost, right? So we think about equity as a lens, we think about human-centered design as a framework, but where does history play? Where does history come into play? And asking those questions as we think about our innovation and our stakeholder engagement, asking, how did we get here? A lot of times it's like, what if, or how can we solve for this? And that question of, well, how did we get here? I think could add some layers to that really important first step. Um, it might help us engage with more empathy when we understand, right? And so thinking about empathy and history being I do think that it could help us be more empathetic. Most of the time we just don't understand enough about the thing or the people or the situation or the process. And we certainly typically don't take enough time to engage with the past, and how it's influencing our present condition.
Yeah, I couldn't agree with you more. I think that, I mean, I've seen that a lot in teaching the policy course when we're looking at policy and sort of dissecting it. And when you start to realize it's really easy to criticize a policy and say, what knucklehead came up with this bone brain idea. But when you kind of look at like why things came to being, it makes so much more sense. And then you have the opportunity to say, okay, well, this was the intention. It didn't do what we wanted it to do, and it's maybe causing harm here, which we didn't potentially see. So, how can we then do what the original policy intended, but also try and mitigate the
Mhm,
unexpected consequences, that had negative impacts on other people?
mhm.
Um, yeah, so that it's really cool to be able to think about it from that lens. Is there anything coming up with the Bates Center? I know this year there's been so many different activities that have been sponsored by the center.
Yeah, this year's been fabulous. We had an opportunity to have Maria Smilos, who's an author of a book called Black Angels, come and join us for a hybrid event or virtual event with Virginia Allen, she's a living legend. She's one of the last living Black nurses who helped to care for tuberculosis patients at Seaview Hospital in New York. And that was really well attended. I think we had over 130 people join to hear one about the book, but also about Miss Allen's amazing contributions. We also had Wendy Klein come recently, also a historian. And so we've really had some really rich opportunities over the course of the last year. And coming up, we'll do woodland walks. And so our woodland walk is an opportunity to visit the grave sites of some nursing legends here in Philadelphia. I also think it's nice to get outside, to take a walk, to be in community. And so I like it for that too, because I think it enriches us in other ways just to be in community and in nature with each other. I'm looking forward to that. One of the things I'm looking forward to doing is really bringing together people who want to help with this vision. So I shared some big ideas, but I really look forward to co-creating. And so I'm going to just be making some calls and outreach for people who want to help co-create the Bates Center's next decade. And that can't be done with me in isolation. So I'm really looking forward to leveraging the interest of people like you and other staff and faculty and students. That I look forward to, as well as beginning to prepare for some collaborations throughout the next academic year.
Sounds great. Well, thank you so much for taking me the time to talk to us about the Bates Center and your new role. And really excited to see what comes out of it.
Thank you for having me. It's been a pleasure.
Hello, Angela. How's it
Oh,
going?
good, Marion. How are you?
I'm good. I loved your episode with Margo. The whole foundation of the work that she's doing and, where she started and where she's at now leading the Bates Center was really a fascinating listen.
You know what? I really, really enjoyed it. I find her to be so incredibly impressive. And the way that she's able to really bring historical context to things that are going on now, especially, talking about innovation. It's like history and innovation aren't usually two things that people put together, but they're so incredibly important and work so well together when you really understand the history of what you're doing. I think it really enriches the innovation that you can do.
For sure. And for anything, not just innovation, you can't figure out where you need to go unless you know where you've been. The foundation that you're building anything on has come from the people behind you. And so understanding those voices, those experiences is so important. And it's not something, to your point, I think a lot of people think about on a daily basis, which sort of makes sense. But I think, where we're at right now in our history is going to be really important for future generations to be able to plan backwards and think about, like, where we need to go. And so the work that she's doing, especially highlighting voices and populations who've often been removed from history, is just essential, in my opinion, to understanding the context, again, of where we're at.
Yeah, I agree. And I think this is one of the things, I mean, there are many things that I think are great here at Penn Nursing, but I feel like this is such an amazing thing that we do, that we've invested so much time and energy and to show how important this is.
Couldn't agree more. And she says it, like, the Bates Center, there's nothing else like it in the world. And the work that's been done to capture the history of nurses in that way is so important and so unique. And it's an amazing space. And the work that Margo wants to do to digitize it, to make it available to more people and to anyone and everyone, is really important.
Amplify Nursing is hosted by Dr. Angela Rosa DiDonato and Marion Leary and produced by the University of Pennsylvania School of Nursing. Music for the podcast was created by Harper Leary. The podcast is made possible by the Krista and Rich Pinola Fund for Innovation in Nursing.
Follow us on Twitter at Penn Nursing. Until next time, keep pushing over, under, around, and through. We want to thank you for listening to the Amplify Nursing podcast and remind you to subscribe to the podcast on iTunes, Google Play, Spotify, iHeartRadio, or wherever you enjoy your podcast listening. And if you can do us a solid, please rate and review us as well. It will go a long way in amplifying our episodes.